green red light in front of me. Is that supposed to be right? That don't count.
We're just giving you examples.
Yeah.
Actually, you know what? I think this is supposed to go over here.
It
I can
doesn't
see it.
move, Ron.
You can see me?
Yeah.
Okay. All right.
Are we ready?
Date, time. Who's involved? she thinks I'm nuts. I know she thinks I'm crazy. Okay. What we're doing today is reviewing the medical screen of your intake process. The new standards state that a medical personnel has to train you. The reason we're taping is so that when you guys have to be yearly recertified or updated, that this is going to be on tape, so all you really have to do is watch the tape. I don't have to come over here every year and be embarrassed. But most of it, very simple. Obviously, name, date, age, sex, race. One thing I didn't see on here was date of birth. I don't know if that's covered on another form of yours or not. That was no big deal. Do you also have on another form insurance information?
Yes.
Okay, I wasn't sure about that one either. All right. Chronic health problems. Chronic health problems could be anything from back problems, a history of knee problems, asthma, diabetes, hypoglycemia, especially with some of the girls. If you see them, they're very thin, they're not eating, they could be hypoglycemic. Any other
But asthma.
asthma?
Musculus, like knee injuries.
Knee
or
injuries.
Chronic
Right.
bone problem.
Okay. Also, you're going to want to know how they treat them. Okay. Do they have medication for that? Okay, and that's going to be covered under the medication area. Also, allergies, very, very important. Are they allergic to any kind of foods, medication, cloths, like wool especially, at least over JDC, that's a big one, because that's what they have is wool blankets. Are they allergic to bees, poison ivy? Biggest thing is medication. Penicillin. Yes? Oh, I thought you had a question.
Where would you put, it says food, medication, clothing, what if it's grass or something, where would you put that?
Okay, we can revise the form to make it so that there is another
Other.
area for other. You know, these are, when I ask my questions, when I do my medical screen, first thing I say, are you allergic to any foods, cloth, bee stings? And I always include bee stings because a lot of people don't say that. And especially it being summertime, you know, kids get stung. And if they forgot to tell you, oh yeah, I go into anaphylactic shock when I get stung, this is a, you know, this is a high priority. Do they need to have an EpiPen around? And I don't know if any of you guys know what an EpiPen is. Okay, it's basically a epinephrine injection. Okay, and they come in packets like about that long. And all you do is you stick it next to a thick muscular area, click the top of it, it'll inject directly into the thigh or the upper arm, okay, or even the buttock, okay, and that should help prevent anaphylactic shock. You should still call 911. You should still get them out to be evaluated. The epinephrine might not be enough, okay. Are they allergic to any medications? You know, penicillin being the most prevalent. Cefalcor and Ceflor are also becoming very popular, quote unquote. A lot more people are becoming allergic to those, erythromycin, things like that. What was your question?
Well, I was just going to say, under the food category, a lot of them will tell you they're allergic to onions or tuna, and they just don't like it. It's not that they're allergic to it, so kind of, you know, question them. Do you get hives? Is it something that, you know, peanuts? Is it, you know, if you're allergic to peanuts, then they can't have peanut butter, peanut products. But a lot of our little critters will, you know, I'm allergic to.
Right.
So how do you know you're?
Well,
Yeah.
actually, the way we handle it is I ask them, what happens when you eat it?
Mm-hmm.
Oh, I just get a tummy ache. I don't,
Right.
just, that's
They're
not allergic.
to it, right?
They just don't like it, okay?
Mm.
Most, if they say they vomit, then I'm going to put that down, okay? If they're going to vomit when they're going to eat it, I'm certainly not going to give it to them. But Is that really an allergic reaction? No. The allergic reaction is hives, closing up of the mouth, swelling up of the mouth, throat closing up. That's an allergic reaction. Okay. But like she said, so many kids will say, "Oh, I can eat tomato sauce and pizza and stuff like that. I just can't eat tomatoes." No. All right. So, and same thing with fish. A lot of people are allergic to fish, and shellfish in particular. But some kids, they just don't like it. So just question them further. That's the biggest thing. When you ask a question, go into it a little bit more. All right. Get as much information from these kids as possible, because the more information you have, the better it's going to be for you if a problem occurs. All right. You'll have more to work with and be able to give to medical personnel when they arrive. Okay. Treatment for allergies, like I said, the EpiPen. Sometimes all they need is Benadryl. Okay. With me, if I take Cephalacor, my throat does not close up, but I will break out in hives, so I need to give Benadryl immediately. All right. So, does it just need hydrocortisone cream? Because I only break out in small little spots in just one arm. Okay. So, religious diets. The biggest one is obviously no pork with Muslims. And if they're Jewish, they may not, especially Orthodox Jews, certain foods cannot go on the same plates. Things like that you have to watch out for. Also, you need to watch out for medical diets. Are they diabetic? Do they need to have certain kilocalories, a certain amount of kilocalories? They can't have sugars. Those things you also have to watch out for. Special health requirements. Braces, retainers, glasses, contacts, prosthesis. You don't see a whole lot of prosthesis, but we have had kids come into JDC with them. So when you do have to see them, find out, do they have to wear special socks underneath them? Most of the time they do. If it's for a leg or even an arm, what cares need to be given to the stump, if any? All right. Keep going. Search and get as much information as you can, because it'll make your lives a lot easier. All right. Kid has braces. Does he need rubber bands? Does he wear headgear? All right. That's also information, because if they're not wearing their headgear, if they're not wearing their braces or their retainers, or the rubber bands, that's going to set back many months worth of orthodontic work. Plus, it's going to set back the parents several $1,000s. Okay. They're already putting out enough with having to deal with their kids coming through this system. The more we can help them out, the better it is. Contacts, do they have their case with them? Do they have solution? Any cleaning products? Things like that. Medication and dosage. What are they taking? What's it for? All right. Oh yeah, I'm taking an antibiotic. I went to the doctor for a sore throat. Well, did they have strep throat? Was it tonsillitis? Okay, tonsillitis is not contagious. Strep throat is. All right. How long have they been on the medication? Okay. And when the medication that comes in, is it current? You should not take a prescription, obviously, that's a year old. Okay. If the medication is, a month old and the kid's been taking it sporadically, you're going to need to get information from the doctor. Do you need me to continue this medication, yes or no? Especially if it's an antibiotic, because it could be at this point in time the child's developed an immunity to the antibiotic and the bacteria or the infection's not going to respond.
If a girl here has strep throat, she goes to the doctor, she has the swab, and she's diagnosed, and she comes back with an antibiotic. Mm-hmm. How long is she on the antibiotic? 24 hours, and then she's not contagious. So
right.
As long as she's on 24 hours, then she could be among the population. So you isolate it for 24 hours.
And how do you handle that at your facility? If a kid comes in here with strep or is diagnosed with strep, do you send them home?
We can. We have. Well, if they're sent out to the doctor, we ask the doctor, is she medically cleared to return to the program? If not, then she'll go home.
So the doctor knows it's a group home, and the doctor knows.
Yeah, we have a form that says Girls Probation House, and that she's a resident here.
Okay. Many times, especially if doctors aren't told right up, they don't look at diddly. Inform them this is a group home. This is a lot of kids around there, so that we don't want these other kids to get it. can she be isolated? I specifically asked information like that.
Okay.
We had sent a kid out the other day with what I was 99.9% sure was ringworm, covered all over his body. And
It
it,
wasn't
and,
ringworm.
and it wasn't ringworm.
It was a virus.
Yeah,
That is not contagious.
but I specifically asked, do we need to isolate this kid because it was so extensive? It covered his whole torso and his upper legs. And why he never said anything before now, I didn't know. But, you know, that I specifically stuck on there and asked the doctor. Okay, so information like that you want to get from them. Okay. The condition the medication is prescribed for, obviously, we just went over that. Psych medications. Make sure that these kids have been taking these medications consistently. All right. Some psych drugs can have withdrawal effects. All right. And so they also can cause seizures if stopped abruptly. So you're going to want to make sure this kid's taking his medications consistently. And if he hasn't, you need to get in touch with the doctor. All right. To find out if he wants to continue on. Does he want to reevaluate her before he continues her on? All right. Any current illnesses or injuries, colds, flu. Did they, and when they just got arrested by the police, you know, they spent one night over at Less Secure and got dropped off to you, say. In the meantime, did they get scraped up? Did they bang their elbow and, man, it still hurts? That needs to be evaluated, checked out. All right. Look at how the person's walking. Look at how they're holding their body. Okay? If they're in pain, they're going to be guarding the area. All right? They're holding their stomach. You know, my elbow hurts, my arm hurts. They're going to be, you know, making sure that nothing goes against her. Okay? Those are things to watch out for. All right? Have they been exposed to any contagious diseases in the past? Flu, colds, strep, chicken pox, lice, scabies. Okay, those are definitely things that you're going to want to cover. All right. Last year, we actually had a case of chickenpox come through the JDC. We got lucky; none of the other kids got it. None of the staff members did. So,
How was that lucky?
well, it is when if you don't want any other kids to have it. But you know, find out if you're around this kid and she was around somebody that had chickenpox, that she can be giving it to you if you've never had them. All right, those are things that you also have to watch out for.
What do you do with the lice?
Okay, lice. Treatment of lice, very simple. All right, you get rid. Okay, buy it over the counter. Make sure that the hair is just slightly damp. Put the shampoo through the hair, and then you use the lice comb that they have. And you have to comb out every section of the hair. Okay. We tend to have another staff member do that instead of letting the kids do that because most of the time they don't get it. All right. This way we can go through the hair and look to see if there's any lice left, if there's any eggs left. Okay. That shampoo has to be left on for about 10 minutes. Okay. Then shampooed out. What we also do over at JDC is we vinegar them up and olive oil and stick it in their hair and let them stay 24 hours isolation. Okay. What that vinegar and oil does is it helps kill any eggs and it makes it easier to pull off the hair.
Sometimes they need another treatment too.
Yeah.
Sometimes it's
Standard treatment is also 5 days afterwards to retreat. Okay. That makes sure that anything that was not caught the first time will be caught the second time.
And the cleaning the rooms and linens, everything, right?
Everything has to be washed hot water, soap. Okay. Vacuum. You don't need to use a spray. Just make sure that you vacuum really well. Cushions.
Take the
rugs.
pillows and put them in a real hot dryer. Pillows don't have to be washed, just high temperature dryer.
Right.
All the pillows.
And wipe down. We've had some massive outbreaks over at JDC. They've had a couple over at Less Secure. I think that you were involved in, or Michelle. And so, believe me, once you don't want anybody else to get it. We've had 30 girls down with it at one time. It's not fun.
Excuse me, is that the same process for crabs also?
Yes, it is. Yes, it is.
That's kind of a common thing.
Especially if the child's been on the run, all right, and they are in a situation where they're with a lot of other people that have not been kept themselves clean or have been sleeping outside and been exposed to the elements where they could catch the lice. Okay. Venereal disease. It's no longer really called venereal disease. They tend to call it sexually transmitted diseases now. And it's always possible. If they have had unprotected sex, yes, it's always possible for them to have an STD. Find out what their symptoms are. All right. Well, I don't have any symptoms. Okay. Well, if that's the case, then it could wait or two. It's not something they need to go out as soon as possible to get the doctor, to have them examined. All right. Well, I just had unprotected sex, and I could be pregnant. Well, when did you have unprotected sex? Well, yesterday. Well, first off, it's too soon to tell if they're pregnant. All right. It's too soon to tell if they have an STD. So, with the pregnancy, yeah, once again, always, any unprotected sex, it's always possible. They have to wait minimum 7 to 10 days for the home pregnancy test, okay, for the hormone level to be high enough to be detected. Okay, so you may want to wait that long before you send them out to be tested. All right, find out when their last periods were. Okay, most fertility time is 12 to 15 days from the start of the cycle. The start of the cycle is the day of their first, the period starts. Okay, so anywhere from 12 to 14 days after that is when they're most likely to get pregnant. All right, female disorders. Do they have endometriosis? Do they have irregular periods? When they have their periods, do they have such severe cramping that they are doubled over in pain? Okay, especially when they're first getting their periods in the first few years afterwards. Those are the times that they're most in pain from cramps. After that, the body starts acclimating to having the period every month, and it becomes easier. Another thing you can tell these kids to help with the periods and the cramping, a lot of water and exercise. Exercise will decrease the amount of the cramping immensely. Okay, rashes and infestations. Rashes, take a look at their arms, take a look at their legs, okay? Especially if they've been on the run, okay? This is the time of year for poison ivy. You're going to see a lot of it. We do all the time. Infestations include scabies, which are mites. They burrow underneath the skin, okay? Best way to find out if they actually have it, take a look at their hands, and they'll actually have furrows, like a plowed field. That's what it looks like in between their fingers and up along here, between their toes, and sometimes around the scrotum. I mean, scrotum, the vaginal area. Okay, those places you're going to want to look for that. All right. Okay.
And that's contagious as well.
Yes, it is.
And then about the what you mentioned prior to this, the
Poison ivy?
yeah, that can be contagious.
Okay. Okay, the only way that is contagious is if the clothes that they're wearing have not been washed from the contact with the sap of the plant.
Okay.
If I didn't wash these pants and I was out there in the woods and then I brushed up against you who had shorts on, yes, I could give it to her. Could I give it to her from the oozing? No. Okay. So it's
We
only
just had
from
that,
the
yeah.
sap, and it's usually from clothes that haven't been washed and stuff like that. You can get it off of animals. The animals will brush against the plant, they'll have the sap on their fur, and you can pick it up that way. Okay? But that's the only way that
So
it's
the
contagious.
oozing stuff isn't.
Yeah. Okay. Condition of the skin, that also includes the rashes and whatever else. Is their skin blotchy looking? Is it yellow? It's jaundice. Jaundice is a byproduct of problems with the liver. Okay? Anything from hepatitis to cirrhosis. Okay? There'll be a palish yellow cast to the skin. You can also check the eyeballs. All right. In blacks, it tends to be harder. Okay, because of the coloring, and even in Orientals. So best place to check can be the eyes. Okay. All right. Bruises. Are they coming in with a hickey, or are they coming in with a huge handprints on their arms? Okay. There's going to be a difference. Okay. Any kind of trauma, scrapes, cuts. Yeah, my dad threw me against the wall. I've got a big lump on the back of my head. This is going to be your cues on, being able to contact CPS. Okay? So go over these kids, talk to them, look at their body. All right? I know it's not like JDC where, we actually take a look at them in the buff. But you want to take a look at them, get as much information, take a look at as much of their body as you can. Okay? Body deformities, anything from a congenital deformity like a shortened arm to, tip of my finger got cut off, when I was joking around with my friend and we were playing with knives. Okay, most of the times, little things like that are not going to make a problem. But with congenital deformities, shortening of the legs and the arms can make a big difference. Okay, do they need any kind of special care because of that? Any special help getting up and down stairs? Handicap access type of thing. Reported history of substance abuse. Okay, now we're lucky in that we have two people asking the same question. First, when they walk in the door at juvenile detention, by one of the staff, and then by us. Okay, a lot of times between those two people, you're going to get two different stories. A lot of times we'll get the correct story, whereas the staff member won't. Okay, and what you're going to want to do is find out how often they're using. Okay, how much do they use? When was the last time that they used? Those are going to be your biggest indicators of this. If this child is going to end up going through withdrawals of any kind. All right. Right now, with the alcohol, most of them haven't been drinking long enough to sustain a whole lot of alcohol withdrawals. You may see some tremors here and there. You may end up seeing some sweating and nausea. You probably won't see the hallucinations or the seizures, but there is also a rise in heroin use. We're seeing it more frequently. All right. Heroin withdrawals, they're going to wish they were dead. Can they die from them? No. All right. Every single body part of theirs is going to hurt. Muscle aches, joint aches. They're going to have vomiting. They're going to have diarrhea. They're going to be sweating profusely. Okay. All of them is going to want to make them say, "Just shoot me now." All right. Usually within several days it's gone. Okay, depending on how heavy of a user they are. Okay. I've seen alcohol withdrawal last up to 2 weeks, but that's usually with the adults. Okay. Same thing with heroin. Kids these age, it's usually a couple weeks. I mean, not a couple weeks, a couple of days, excuse me. If they're a multi-drug user, find out all the drugs they use. Oh yeah, I smoke a little pot here and there, but then I could do ecstasy every day and crack, every night with my buds, and find out everything that they're using. Because when they're using all these different drugs, they're going to withdraw, okay? And you're going to see a combination of symptoms, okay? They're going to really hate life for a while, okay? And it can take for them to totally detox, especially if they've been using for a long time, a total month for their body to be totally clean of drugs, okay? And first couple of days are always the worst, okay? So keep an eye out for it. I'm going on to the next page to the, also going on to the second question. Does youth appear to be under the influence of drugs or alcohol? All right. Most of the times, you're going to be able to smell that alcohol, okay? And you're going to be able to smell if they're smoking. Take a look at their eyeballs. Are their pupils dilated or are they constricted? If they're constricted, it could mean they've been using cocaine. Dilated is usually alcohol. All right. So those things you're going to want to look at. Are they slurring their speech? Are they unsteady on their feet? Oh, these are going to be cute clues. Most of the times you get kids after they've been through us, they don't tend to come straight from the streets to you guys, do they?
Sometimes.
Sometimes.
Yes.
Okay. All right. So those are some of the things you're going to want to watch out for. That's also going to tie into the first question. Is youth oriented to time, place, and person? All right. If they're under the influence of drugs, they may not know what time it is, and they may not even know where they're at. Okay. But if they're not under the influence of drugs, okay, that could, if they're not alert or oriented, it could mean a head injury, and it could also mean psychological problems. Okay. So once again, ask. Did you get hit in the head recently? You've been in a fight, something like that. Okay, that's going to make a difference. Okay, and all this is going to go hand in hand all the way down through your mental health. Okay, would you like me to go ahead and go over mental health? Okay. Does the youth appear to be despondent, depressed? Is he just a little bummed out because he just came for court, found out he has to be here for another 2 months? Or is he just totally unresponsive to your questions? Is he isolating himself totally? those are things you're gonna look out for there. First timers, just after a kid has been sentenced, and also if they've had any bad news from the family or their PO. Okay, those are times that you're going to want to watch out for these kids when they could be either suicidal or become more depressed than they usually are. Okay. Does the youth appear to be irrational? Once again, this could kind of being under the influence, or it could be a mental health, or even it could be diabetic problems or head injury. Okay, so this is why asking as many questions as possible is going to aid you in the long run. Does the youth pose a health risk or safety risk to himself or others? If he's got lice, you're not going to want to stick him in the room with the rest of the kids. Okay. If he is, I feel like I'm going to kill myself, you're not going to want to stick him alone. You prefer to have him with other people. Okay. Does the kid have any problems with this or worries about his family or any relationships? Oh yeah, I just got my girlfriend pregnant. She's due, in 6 weeks. That's going to be a big, oh you guys, this is girls. I apologize. Please forgive me. I'm so used to dealing with boys and girls.
Usually takes 9 months. That's
Well, you know what, okay. See, this is why I didn't want this on tape. Okay, but yeah, did they find out they were just pregnant? Or are they due, things like that are going to be worrying. Did they just get beat up by their parents and they don't want to go back home? All of this is going to, tie into their mental state. Any other concerns noted by the youth? Man, I'm failing school. I don't think I'm going to pass. I'm supposed to graduate this year. Those are things you also want to check out. Ease of movement. Okay, this is going to go back to any injuries. Can the person walk without difficulty? All right. Are they moving their arms and moving their head without problems? All right. Goes back to injury. Can also go back to being under the influence. All right. State of consciousness. Once again, back, head injuries. Are they under the influence? Or, man, I've been up for 48 hours. We've been partying.